Live Life Liverpool began with a simple but powerful ambition: to create a weight management service that genuinely meets people where they are, in their communities, in their daily lives, and within the systems that they already trust. January was about mobilisation and trust, beginning by assembling our skilled and compassionate delivery team to support residents across our city. At the same time, we designed clear pathways for adults, children and young people, together with pre- and postnatal support, so that we could respond to the people at every stage of life. Early accessibility was key, so our new website launched with a self-referral tool, an online BMI checker and health blogs, giving residents the opportunity to take the first step themselves in their own time. February focused on listening, with virtual and face-to-face co-creation events. Residents, partners and professionals helped shape the service, ensuring lived experiences sat at its heart. We worked closely with neighbourhood managers touring communities across Liverpool, from North Docks to Belle Vale, Norris Green to Speke, Toxteth and the city centre. These conversations helped us understand local strengths, challenges and opportunities, ensuring the service was relevant and grounded from the outset. By March, Live Life Liverpool were becoming visible through the intensive awareness campaign, which saw the team visit 58 GP surgeries in Liverpool's most deprived wards. These visits were about building confidence, understanding pressures in primary care and positioning the service as a trusted Tier 2 offer. We began embedding within trusted community spaces, including family hubs, food pantries, grassroots organisations and local charities, ensuring people could access support in places they already knew and trusted. April marked a shift towards embedding. Direct, seamless referrals were enabled from GP practices by EMIS. The service engaged with all 9 primary care networks, building relationships with social prescribers, physiotherapists, dietitians and wider clinical teams. These connections quickly evolved into regular engagement and connection to ensure professionals understood how and when to refer. May brought a key moment of system integration as Live Life Liverpool was introduced to professionals across early help, education and community health at the Family Health Practice Forum. This immediately unlocked new referral routes, leading to exploring how the service can be embedded in family health pathways. Community investment discussions also gained momentum, with local partners exploring how physical activity, cooking skills and wellbeing programmes could strengthen Tier 2 delivery. June demonstrated scale and reach. The team attended 78 events spanning hospitals, job centres, schools, community hubs and public spaces. Relationships strengthened with services like Alder Hayes CEW Clinic and the Job Centre Plus. Education became a growing focus through the Healthy Schools Pledge and partnerships with Food Active, SIL and LSSP. Together we co-delivered classroom-ready PSHE resources to promote healthy eating and active lifestyles, while links with primary schools laid the groundwork for future delivery. Digital access evolved to extend support into people's homes, with the creation of high-quality exercise videos, including adult workouts, maternity movement sessions and family-friendly routines. By July, Live Life Liverpool had become a recognised and trusted part of Liverpool's public health landscape. Targeted primary care network text campaigns were launched, sending over 8,000 messages to eligible patients and generating more than 300 referrals. This data-led approach demonstrated the power of aligned systems and proactive outreach, paving the way for expansion across additional networks. August focused on inclusion, developing new group sessions with Polish community leaders, Daisy Inclusive and the Brain Charity. Work also began to improve accessibility through specialist equipment. Community investment became a reality with the launch of the schools-based cooking programme in partnership with Beautiful New Beginnings. Piloted at St Anthony of Padua Primary School, demand exceeded expectations, generating waiting lists and supporting families to build confidence, skills and healthier routines together. September marked a step forward in influence and visibility, with Live Life Liverpool taking part in the Liverpool Food Summit, joining the Dementia subgroup and continuing to contribute to the Active City Partnership and the Good Food Task Force. Public engagement grew through AAA screening days, Know Your Numbers event, and live BBC Radio Merseyside interview, reaching thousands of residents and reinforcing the service's role within the city's prevention agenda. Children and young people's delivery continued to expand, with structured 6-week programmes delivered in schools and community settings, growing demand from across the city. October was a month of growth towards maturity, embedding the targeted PCN text referral model in PCNs covering Speke, Garston, Chilwell and Dovecot, becoming a trusted and proactive referral mechanism within primary care. November saw a major milestone in inclusion and growth in trust. A send and sensory-friendly children and young people pathway was piloted, with sessions adapted to reduce anxiety and support parents alongside children. Early feedback showed improved engagement, confidence and trust, shaping a scalable send model for the future. Community partnerships also moved fully into delivery, with co-produced sessions across diverse communities grounded in dignity, accessibility and cultural relevance. December focused on reflection and quality for the future. Programmes continued through the festive period, supporting families at a high-risk time for weight gain. Alongside this, the team reviewed referral data, captured learning, gathered case studies, and identified the models with the strongest impact. By the end of year one, LivLifeLiverpool had transitioned from a new service into a strong, trusted, system-embedded programme ready to scale with confidence. Year one built the foundations, year two builds the future.